Welcome to the fourth lecture of our Pharmacology Made Easy series here on the Daily Pharma channel. I am Marwan, and today we'll be diving into how drugs are affected by pharmacokinetic processes. In the last two lectures, I covered the four key pharmacokinetic processes: absorption, distribution, metabolism, and excretion. In this lecture, we will be discussing the following topics: what is half-life, what is steady-state concentration, why are some drugs are formulated as sublingual tablets, when is a drug completely eliminated from the body, why do some drugs have longer half-lives than their duration of action. Now, let's begin our discussion on how pharmacokinetic processes affect drugs. To start, any factor that increases the volume of distribution of a drug or drugs that have a large volume of distribution can lengthen the drug's half-life. For instance, digoxin, propranolol, and azithromycin are examples of such drugs. This phenomenon occurs because drugs with a large volume of distribution are distributed throughout the body rather than being confined to the bloodstream. As we discussed in the previous lecture, if a drug is primarily distributed in the blood, it's quickly transported to metabolic organs like the liver. Here, the drug is often metabolized into a more polar form, which facilitates its excretion by the kidneys. Consequently, this can lead to a shorter half-life for those drugs. Conversely, drugs that have a large volume of distribution are distributed throughout interstitial and intracellular fluids in addition to the bloodstream. This distribution diminishes their transport to the liver, leading to a reduced rate of excretion by the kidneys, which ultimately results in a longer half-life for these drugs. So now, what exactly is half-life? Half-life is the time it takes for the concentration of the drug in the plasma or the total amount in the body to be reduced by 50%. For example, when you take 500 mg of acetaminophen, the time it takes for the amount of the drug in the body to decrease to 250 mg is referred to as the half-life. Therefore, based on the provided diagram, the half-life of acetaminophen is 3 hours. Understanding half-life is crucial for determining steady-state concentration and appropriate daily doses, which we will discuss later in this lecture. Now, let's explore why some drugs have longer half-lives than their duration of action. For instance, amlodipine has a half-life of 50 hours, but its duration of action is only 24 hours. This difference can be attributed to several factors. First of all, receptor binding. Drugs that bind to receptors may have a longer presence in the system than their actual therapeutic effects, especially if they dissociate slowly from the receptor. Secondly, distribution. Drugs that have a large volume of distribution may be widely dispersed throughout the body, leading to a longer half-life. However, their effects may be localized and only last for a short period. Thirdly, physiological adaptation. The body may adapt to the presence of a drug through various physiological mechanisms. For example, if a drug acts on specific receptors, the body might decrease the number or sensitivity of those receptors over time, reducing the drug's effectiveness despite its longer half-life. The fourth and last factor is local clearance. Some drugs may undergo metabolism or inactivation at specific sites of action by enzymatic action, rather than being cleared uniformly throughout the body. This local clearance can shorten the duration of action while the drug remains in the systemic circulation. As we mentioned earlier, understanding half-life is crucial for determining steady-state concentration. So what exactly is the steady-state concentration? Steady-state concentration refers to the point at which the overall intake of a drug is equal to its elimination, resulting in a stable level of the drug in the bloodstream. At this point, the concentration of the drug remains relatively constant over the time. The daily dose of a drug is determined by its steady-state concentration. This is why medications are often taken at specific intervals throughout the day to maintain the drug's concentration at steady state. At this concentration, the drug can provide the desired therapeutic effect consistently, ensuring effective treatment while minimizing the risk of toxicity or subtherapeutic levels. Generally, any drug requires about 4 to 5 half-lives to reach steady-state concentration. At this point, the rate of drug administration equals the rate of elimination, resulting in a stable concentration in the bloodstream. For example, if you take a 100 mg dose of a drug, after the first half-life, the drug's concentration will decrease to 50 mg. When you take a second 100 mg dose, the total concentration will rise to 150 mg. After completing the second half-life, this concentration will reduce to 75 mg. When you take a third 100 mg dose, the total concentration increases to 175 mg, and after the third half-life, it decreases to 87.5 mg. After taking a fourth 100 mg dose, the concentration will rise again to 187.5 mg, and after the fourth half-life, it will reduce to 93.75 mg. When you take a fifth 100 mg dose, the concentration will increase to 193.75 mg, and after the fifth half-life, it will decrease to 96.5 6.87 milligram. This is close to the desired dose of 100 milligram. The same principle applies to the drug elimination. It takes approximately 4 to 5 half-lives after the last dose for a drug to be completely eliminated from the body. Many medical students often confuse this concept, mistakenly believing that simply multiplying the drug's half-life by 2 will give them the total time required for the drug to be fully cleared from the body. For example, let's use the same 100 milligram drug to illustrate this point. After reaching the steady state concentration and taking the last 100 milligram dose, it will take about 4 to 5 half-lives for the drug to be completely eliminated from the body. After the first half-life, the concentration decreases to 50 milligram. After the second half-life, the concentration decreases to 25, and after the third half-life, the concentration decreases to 12.5 milligram, and after the fourth and fifth half-lives, the concentration decreases to 3.125 milligram. By the end of the fifth half-life, the drug will be significantly reduced, nearing complete elimination from the body. This is why, for a drug like valsartan with a half-life of 6 hours, it will take approximately 24 to 30 hours for the drug after the last dose to be eliminated from the body. This raises another question. Does a drug provide its desired effect only after reaching steady state concentration? The answer is no. Most drugs begin to work after the first dose is taken. However, to maintain a consistent therapeutic effect, the drug must be administered at specific intervals throughout the day to achieve steady state concentration. Another topic we will discuss today is the kinetic of metabolism. The kinetics of metabolism refers to the study of how drugs are metabolized by the body, focusing on the rates and mechanisms of the metabolic processes. Metabolism can follow different kinetic orders. For example, first order kinetic and zero order kinetics. In the first order kinetics, the rate of metabolism is proportional to the drug's concentration. This is common for most drugs at a therapeutic level. Most drugs exhibit first order kinetics. For example, if we start with a drug at a concentration of 1000 milligram and 16% of it is metabolized after 2 hours, the concentration will drop to 840 milligram. After another 2 hours, 16% of the remaining concentration will be metabolized, reducing it to 705 milligram. Following another 2 hours, 16% will be metabolized again, bringing the concentration down to 592 milligrams. As you can see, the amount metabolized over the time changes. Initially, the drug is reduced by 160 milligram, then by 135 milligram, and finally by 113 milligram. This occurs because as the concentration of the drug in the blood decreases, the amount metabolized also decreases. While some less common drugs exhibit zero-order kinetics, where the rate of metabolism is constant and does not depend on drug's concentration. A constant amount of the drug is metabolized per unit of time. For example, drugs like aspirin and metoprolol are metabolized by zero-order kinetics. For example, if we start with a drug at a concentration of 1000 milligram, it will be metabolized by 20% after 2 hours, reducing its concentration to 800 milligram. After another 2 hours, it will be metabolized again, bringing the concentration down to 600 milligrams. After an additional 2 hours, it will be further reduced to 400 milligram. In this case, the amount metabolized over time remains constant at 200 milligrams, regardless of the drug concentration in the bloodstream. Initially, the reduction is 20%, then 25%, and finally 33.3%. This demonstrates that the metabolism of the drug does not depend on its concentration in the bloodstream. Another topic related to metabolism is first-pass hepatic metabolism. This is why some drugs are formulated as sublingual tablets rather than conventional tablets. Why is this the case? Generally, after absorption from the gastrointestinal tract, drugs enter the liver via hepatic portal vein. From there, they move into the bloodstream, passing through the veins to the heart, then to the arteries, and finally distributing throughout the body. First-pass hepatic metabolism occurs when a drug is absorbed from the gastrointestinal tract and then metabolized extensively by the liver before it enters systemic circulation, such as nitroglycerin. As a result, the drug will be metabolized and excreted through the kidneys quickly, leading to a loss of its desired effect. As a result, some drugs need to be formulated as sublingual tablets instead of conventional tablets. The reason for this is that sublingual administration allows the drug to be absorbed directly into the bloodstream through the mucous membranes in the mouth, bypassing the liver initially. This route avoids the first-pass effect, which can significantly reduce the bioavailability of the drug. By using sublingual tablets, the therapeutic effect of the drug can be achieved more quickly and effectively, as a larger proportion of the active drug reaches systemic circulation without being extensively metabolized by the liver. That topic concludes our discussion for today. In our next lecture, we will delve into the second aspect of pharmacology, known as pharmacodynamics. If you found this lecture enjoyable and beneficial, we encourage you to subscribe to the Daily Pharma channel and click the bell icon to receive notifications for our future lectures. Thank you for tuning in.